Power plans place orders. Power plans contain interdisciplinary orders sorted by category. The categories follow the same order as found in the View Navigator. Power plans can be pre-planned and initiated at a later time. You have examined your patient and you decide to select the IM Asthma COPD Admission to Med-Surg Power Plan to enter order for your patient. Click Add. The Add Order home screen lists power plans inside of department-specific folders. There are two filters for searching, Contains and Starts With. When the filter is set at Contains, every order containing the search word displays. Click on the IM Department folder. After clicking on the IM Department folder, the power plans in that folder display. Click on the IM Asthma COPD Admission to Med-Surg Power Plan. When the power plan orders have populated on the order screen, the power plan will turn dark blue. Click Done when complete. During your review of these orders, you select or deselect appropriate orders for your patient. The first order you want to add under the Activities section is May Shower. To select the order, check the box to the left of the order. Scroll down to review the available diets. There should only be one diet ordered for the patient, and the general diet is pre-selected. Your patient is diabetic, and you will need to deselect the general diet and select the diabetic diet. Select the routine intake and output as you want your patient on routine intake and output. There are no further nursing orders to select. The list of orders in the power plan follows the same order as the list in the View Navigator. You want the patient on dextrose 5% with 0.9% NaCl. Click the checkbox next to the order. You note that the default infusion rate is 80 milliliters per hour. You want the patient on 100 milliliters per hour. Click the drop-down arrow in the dextrose row and select the appropriate option. Next, you want to order plain acetaminophen. Check the box to select the medication. You know that the patient recently had an X-ray that showed an infiltrate and you want to order azithromycin. Check the box to the left of the azithromycin order. You routinely order Singulair for your asthma patients. Singulair is not part of the power plan, but you would like it added. When you are ready to discontinue the power plan, you can quickly discontinue the Singulair as well. Click Add to Phase and then select Order. In the Find field, type Singulair and select the medication order for Singulair. Select 10 milligram tab PO at bedtime from the Order Sentences window and click OK, then select Done when finished. Every patient must have a form of VTE prophylaxis ordered or reason VTE prophylaxis not received must be indicated. This is a requirement to meet the government standards of meaningful use. You notice in the IM Asthma COPD Power Plan that there are 3 VTE subphases with different risk levels. You decided that your patient has a medical low risk of VTE, so you will need to check the appropriate box for this option. The subphase for VTE DVT prophylaxis medical low risk opens. You want your patient to have SCDs and need to check the box next to the order. Click Return to IM Asthma COPD Admission at the bottom of the subphase window to go back to the main part of the power plan. The VTE subphase now displays as selected with the rest of the various orders that have been chosen within the power plan. Click Orders for signature. Often, the decision support window displays when attempting to sign orders to indicate that a patient has an allergic reaction or there is a duplicate order. This patient has a documented allergy to Zithromax. You have reviewed the allergy information for the patient and see that the patient became nauseated when taking the medication and does not have a true allergy. You elect to override the warning. From the drop-down list in the Override Reason field, select the Not Clinically Significant Monitoring Override Reason. Click Continue. No more decision support windows display, so you are ready to sign. Click Sign and remember to refresh your screen. Power Plans view excluded components. Once signed, the Power Plan displays the components that have been ordered. After signing, only the ordered components display. However, you can still reopen the Power Plan to select additional components. If you have forgotten to add a component, do not continue the current Power Plan and add another one. That would cause confusion and duplicate orders to multiple departments. You forgot to add a cardiac monitor for the patient. You've already signed, but you can still go back in and add that forgotten order. From the View Navigator, click the I Am Asthma COPD Power Plan and select the light bulb icon to view excluded Power Plan components. Scroll down to locate Cardiac Monitor and check the box next to Cardiac Monitor. After checking the box, the Cardiac Monitor order now displays a light bulb, indicating that it will now be included in the Power Plan order. Click Orders for Signature and then sign. Power Plans Merge View. Many Power Plans contain the same orders. Use the Merge View function on the Orders Profile window as a quick method of searching for duplicate orders. The Merge View enables you to view all orders on the patient's electronic chart, including those placed from a Power Plan and those placed individually before the orders are signed. From the Order Profile toolbar, click the Merge View button. Notice that there are gold category bars dividing the orders. The orders that display above the gold line are the proposed orders you just placed. The orders that display below the gold line are any active orders that were previously ordered for your patient. You can see that the CBC no diff order that is located below the gold line has already been signed and has a status of ordered. Since you don't want to duplicate orders, deselect the unsigned CBC no diff order located above the gold line. You have completed your review of the orders. Select Orders for Signature and on the next screen, click Sign.